then it's not going to happen to me.
That's exactly
it's not,
right.
Or there's two things. It's not going to happen to me. Or the other part is that we tend as parents,
not my kids,
or we pace our experience onto them and say, well, I smoked a little bit of pot, or I did this, or I did that, not realizing that they're an individual and there is a negative effect. So from that point of view, the myth is that it's okay. I have a parent tell me, I know my son he smokes a little pot before he goes to school. I said, he's 13. And he's not smoking a little pot. He's dabbing. He's dabbing 98% THC at 13 years old before he goes to school. And he says, and I quote, at 13, I need this to cope. That's just terrifying. And
I did too.
Yes, and it's true. So then that goes back to, we need therapy. We need to understand what's going on with my son.
And I certainly didn't have that.
And there's kids that we're seeing too. I think the myth of like, everyone's doing it, why can't I do it? And we're seeing kids with severe mental health disorders.
Right.
There's a difference between someone with 1, 2, 3 mental health diagnoses and a kid without. Not that any of them really at 13, 12 or 13 should be doing it, right? But there is a difference. There is someone who's really predisposed to what we were talking about earlier, like psychosis, dabbing and like having, really, really concentrated THC versus someone who's not.
I think the biggest myth is, right, and we went over
it,
is I don't know anybody who's died of my kid's not going to die of he's just being a kid. And it's not if, it's when now. Because everybody's dropping from this.
Yeah.